Dan Myers of Alimera, thanks for joining us.
Great, thanks for having me, Tom.
You've been a regular at OIS. We're always grateful to have you here. I wanted to get an update on where the company is. What's your latest information?
Great, well thanks for the opportunity. We're excited about 2017 and rolling into 2018. It's a pivotal time for us because, as you know, we've been at this for a little while, and as you mentioned, a lot of OISs, but we think the company's moving to a cash positive position in 2018, which of course for any commercial organization, that's the ultimate target. And so through expansion in Europe, we're now in 7 countries in Europe, our approval in the US, and our organic growth in the US, we're about 14% growth year over year.
Terrific.
So we're happy with that. We think our long-term compliance story with a microdosing of Iluvien and our implant for 3 years is resonating. And so I'm very excited about where we're at, and it's been, as you said, been a journey.
Excellent. Well, let's talk a bit about the journey. OIS is coming up on its 10th year next year. Looking back over the past 10 years, how have the challenges for innovating in ophthalmology changed, for good or for bad?
Well, I think actually Emmett might have touched on a few of those this morning in his opening talk. Getting through the FDA probably was the most difficult thing that I experienced that I had not anticipated. As you remember, we had a bit of a time getting through the FDA with our CRLs, and as we noted today, there was quite a few CRLs have been issued, and so I think that's probably a little more difficult maybe in my earlier years. The interaction with the FDA is good, but I think some of the hurdles there, especially in the CMC area, are maybe a little more difficult than it has been in the past. Clearly reimbursement and the economics of ophthalmology, especially in the space we're in the retina, has had an element of difficulty at sometimes in saying, what's best for the patient, in some cases what we believe obviously a 3-year microdosing implant, versus just quite frankly the economics of getting reimbursed for other injections and so forth. So, unfortunately sometimes the economics do play a role in this, and it's probably a little different than back in the days when the ophthalmologist was king, and if they wanted their drug in a surgical center or they wanted it in a hospital, they got it. And these days, as we know, that's a little more complex.
So I'm going to ask you to look forward then, put on your special virtual reality goggles, okay. Take us to 2027.
Right.
How does ophthalmology change in terms of the treatments available? Alimera obviously will be a huge success by that point. You'll own an island somewhere, I'm sure. But
I'm not going to be doing this with you. I'm sure of that.
How do you see things shaping out over the next decade?
Yeah, well, I think clearly in our space, I mean, the progress in retina of the last 10 years has just been remarkable. When we think about the advent of the anti-VEGFs and the long-term implants that we've had in the steroid marketplace now, I see that just continue, because clearly we can't keep treating patients in the retina space on monthly, bi-monthly, quarterly injections when you've got 65 million baby boomers coming through. We got diabetes growing at epidemic rates. So I think compliance, as Emmett mentioned this morning, compliance is going to become part of the efficacy story of how do we treat all these patients with these chronic diseases like DME or dry AMD. So certainly to me, finding better ways to deliver, whether it be a steroid and anti-VEGF, combinations thereof, is going to be a clear path forward for innovation. And those who can figure it out will be successful, and they'll have their island.
I hope you're the guy. Yeah. Thanks for joining us, Dan.
Okay, great, thank you.